I'm Raj with Sickbay. Sickbay lives inside the hospital and delivers physiologic data at scale. Today, I'm with my colleagues Mishan and Curtis to talk a bit about making care personal. Thanks for joining us.
Good morning,
Thanks.
Curtis.
Hey, thanks, Raj. Hey, Mishan.
Hey. All right. So you've been in this setting quite a few times. Tell me a little bit about your experience and the family's experience in acute care.
Sure. So a lot of this is personal. I mentioned the story from before, but on the personal side, it really starts with stress. The second you're presented with something is wrong, stress levels go up. And if pain is involved, particularly in something that's, hurting your loved one or hurting you, the stress level is even higher. So, you get to the hospital and you're stressed again. You go through the process of admit, you get to a table, you get to a room, hopefully. And your first thought is, let's find out what's wrong, let's fix it, and let's get out of here and get back to whatever the heck normal was. But really what happens is, you kind of forget about, hey, how the heck do we get back to normal? Because you're inundated with information, whether it's terminology related to the diagnosis, which is often not spoken in regular human language. It's usually in doctor speak, and good doctors will help dumb it down for you. It's medications, it's side effects, especially the scary ones in a certain situation. But your blood pressure just continues to go up. And that's really hard. And really in today's world, especially with AI, what's the first thing that I did and what's a certain normal reaction? Hop on the internet, and now you can ask the bots, what's wrong with my kid, or what's wrong with my mom, or what's wrong with me? And the bot just says, this is what's wrong and this is how you should treat it. And this is your likely outcome. You have no idea. But all of a sudden, or you've read it. And now there's this game of, who do I trust? And am I going to use this information to ask the doctor questions? And that's really hard to do. But interesting along that journey, what happens to you or your loved one in the room? Rounds happen in the morning. Rounds happen at shift change. People come into the room to change, a bag if you're on a drip, or give you medicine, or just take your blood pressure, check your vitals, and then they leave. But what happened in that time span is you, as the advocate, become that second by second, minute by minute tracer of information. So when the doctor comes in the room, what's the first thing you want to do? This is what happened. What about this? Did something go wrong? Does the doctor need to know about this? Selfishly here at MIC, that's Sickbay. Sickbay is the actual trained eye on the data of everything that's been happening to you. It's sort of like your co-advocate, if you will, but except it's rooted in data, not in emotion. And that's really important.
Yeah, it's so important to have that basically black box recorder of everything that happened to the patient, because you're right, emotions and conjecture and opinions can get in the way of what's actually real with that patient. So talk to me a little bit about kind of your hopes for families as their experience starts to get better when the clinician has the right data in front of them, and then what can happen over time and how the stress can get reduced over time on the families when there are readmits and you have that same information.
Good question. I talked about, let's get out of here and find the new normal. Well, in acute care cases, especially in chronic acute care cases, that's really hard, because the new normal is constantly evolving on you. And so understanding how to handle that new normal and how that new normal evolves, not just for the patient or the loved one in your family or a friend in your network, or to you personally, you're also trying to self-discover what your new normal is. And what's really cool about what we do with Sickbay is, what happened the first time that was captured every second that you were in that monitored bed, that history stays with you. So inevitably, in a chronic condition, you're most likely going to end up in the hospital again. So what happened last time and what happened now? Is it the same? Has it changed? What does those changes mean? What do the similarities mean? But the fact that a clinical team and the people that are caring for the person in the bed and yourself can actually have the awareness, and everybody involved in treating you has the awareness of the before, the after, and now what's happening, is so vital to making sure that the right treatment is provided. It raises the level of assurance in one of the high stress moments of your life. And that just feels really good, and it's the right thing to do.
Yeah, it's really important to remember that it's not just the patients that we affect, it's the lives of the family members that have to deal with everything that's happening to them day in and day out for their loved one. I'm really happy to hear about how we can get perspective on ways that we can help that. Thank you, Curtis. This was wonderful to talk to you today. Raj?
Yeah, thanks.
Yeah, it strikes me that, at some point, everyone will need this level of care, or everyone will have a family member who needs this level of care.
That's right.
And in those situations where there's just so much unknown, so many things changing, so much uncertainty, that it's good if we can provide a little bit of that stability, right? A little bit of that history, a little bit of that data that can help make that difference and help separate, as you're saying, the emotions and the feelings and the sort of that, that roiling, with a little bit of, fact, a little bit of, objectivity. That's got to go quite a distance. So thank you for telling that story. If you out there are interested in learning more about Sickbay, or if you're a Sickbay user and you'd like to come and talk a little bit about how you use Sickbay, come drop Mishan and I a line. We'd love to hear from you. In the meantime, take care, and we'll see you next time. Thanks.